Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. Statistics compiled by the World Health Organization in 2002 suggest that glaucoma is now the second leading cause of blindness globally after cataracts and is much more damaging. It affects 1 in 200 people aged 50 and younger and 1 in 10 over the age of 80. One of the reasons why glaucoma has assumed the second position is age. As populations grow older, the prevalence of the disease rises. Those aged 50 years and older in the global population increased by 30% between 1990 and 2012. Now, the increase in population of those 50 years and over was 16% in developed countries and 47% in developing countries. It follows then that the number of those with glaucoma would be much more in developing countries. Our guest today is Dr. Chinedu Okeke. He is an ophthalmologist at the Anchilla Eye Center in Lagos. You're welcome to the show.
Thank you very much. It's a pleasure.
Glaucoma is more in developing countries. That means more in Nigeria. Is glaucoma just one type of disease, or do we have many glaucomas?
Good. Thank you for the question. Now, when we talk about glaucoma, we are referring really to a group of diseases. But what they have in common is that they damage the nerve of the eye, which we call the optic nerve.
Okay.
So what happens in glaucoma, which is different from cataract, which everybody knows about cataract, but for glaucoma, what happens is that there is an increase in the pressure in the eye, in most cases, and that leads to a damage to the nerve that takes impulses from the eye to the brain for interpretation.
Okay. Now, can you just quickly tell us a few of the types of glaucoma? I know there's one called open angle. Are there others?
Yes. Now, there are different types of glaucoma. Well, we need to understand what really happens in glaucoma. Now, the eyeball has a fluid inside that helps it to maintain the shape. We call it the aqueous humor.
Okay.
So
that's the one you have in front.
Yes. So the fluid is necessary for the eye to maintain the shape. And then...
even the shape?
Yes, the shape, and also for the eye to see clearly. So the eye secretes the fluid and also drains away the fluid. So there's a mechanism through which the eye secretes the fluid and then drains out the fluid also.
Does it act as an eye wash? I mean, secretion, drainage?
Yes, well, we can call it like, you can look at it like a drain.
Okay.
So there's a balance between the secretion and then the drainage. So when there is a problem with that balance, maybe that the fluid is not going out from the eye as
it should.
Yes, then we now have an increase in the pressure. So now, when there is an open angle, meaning that even though the angles through which the aqueous drains is open,
okay,
but some particles are clogging it. So we refer to that type of glaucoma as an open angle glaucoma. And then when that drainage is closed due to one reason or the other, we refer to that type of glaucoma as angle closure glaucoma. Now, glaucoma generally can be classified as congenital because glaucoma can also occur in children. Children can be born with glaucoma. But more commonly, we have...
you'd call that congenital
glaucoma? But more commonly, we have what we call acquired glaucoma, which occurs as we are getting older, acquired glaucoma. So now those congenital and acquired glaucoma can now be further classified due to, according to the mechanism of damage into open angle or angle closure. Now, if naturally the eye is okay, there was no problem with the eye, and then the eye developed glaucoma due to no secondary problem, we call it a primary glaucoma. So we can have a primary open angle glaucoma or a secondary open angle glaucoma if it is as a result of other disease conditions affecting the eye. Likewise, we also have a primary angle closure glaucoma
and then a secondary angle closure glaucoma.
So these are the broad classes of glaucomas.
Now, let me ask you, already we've established that age is a factor in glaucoma. The likelihood of getting glaucoma increases with age. Is that not right?
Yes. Right.
Now, what else increases the likelihood? Who is susceptible to this glaucoma?
Good. Now, the race is very important when you talk about glaucoma. As a matter of fact, some people have called glaucoma a black man disease.
Okay. So and is that true?
Well, yeah, because it is more prevalent in Africans, even in African Americans and in Latinos. So the fact that you are a black man predisposes you to developing...
Just by being black?
Yes. And as you mentioned earlier, increasing age, as we are getting older, the risk of developing glaucoma becomes higher. Now, some types of glaucoma, like the primary open angle glaucoma, is more common in people that are myopic. So if you are short-sighted, yes, you have a higher risk of developing glaucoma. Also, if you have had trauma to your eye, maybe you have had an injury to your eye in the past, the chances of you developing glaucoma is higher than in the general population.
Okay. Now, does it have symptoms? Okay.
Now, generally, the problem we have with glaucoma is because it's actually called a sneak thief of the eyesight. Really, because before you develop symptoms from glaucoma, you must have gotten to the very advanced stage. So initially, there are little or no symptoms from glaucoma, but until the disease has progressed to a stage that the patient starts losing vision, and by that time, it's already too late. So it's very important.
Too late?
Yes.
Too late for what?
Yes, because the damage done by glaucoma is irreversible. So it is better that it's detected earlier before symptoms from the disease start appearing.
Okay. Now, before we go to how it is detected, tell me a bit about neonatal glaucoma. Why would a child be born with it?
Okay. Now, as we said in this, as we demonstrated earlier, you can have some congenital problems with the angle through which the aqueous, rather the fluid from the eye.
That's the fluid at the front.
From the front,
this glassy piece.
Yes, through which is draining. The child may be born by that, like that way, due to some deformities, congenital abnormalities. So, and when that happens, the pressure in the eye gets high, and then damages the optic nerve.
Is there anything that can be done for that child? Because it looks like it's an emergency as soon as he's born.
Yes. The good thing about congenital glaucoma is that if there is prompt intervention, the child regains the vision. Simple surgery can create another opening for the aqueous to drain through and then reduce the pressure in the eye, and then the patient regains the vision.
Okay. Speaking about openings, what you said that the angle may be blocked with particles. Where are these particles coming from?
Yeah, these particles are already in our blood or in our body. We can have pigments that come from the iris. You can also have some
That's the colored part of the eye.
Yes. You can also have what we call white blood cells settling on those angles, or you can also have inflammatory materials, debris.
So they just circulate and go there and block the entrance?
Yes, it's just like a kitchen sink. As you are cooking and you are washing, particles are going to the sink and is blocking the drainage. So, and that's similar to what happens in patients that have glaucoma.
Okay, at the risk of being very simplistic,
okay,
the kitchen sink, before you put the dishes in, there's the provision of scraping off particles from the dishes before putting them in the sink. Yes. Is there something like that for the eye? Can you prevent those particles from ever reaching the point where they block the angle?
Yes. Now, what we said is that the eye has an innate mechanism of taking care of that, washing away those debris that come to the angle. But in some people, that mechanism is no longer effective.
Okay.
And that results to the abnormality that we're talking about.
Now, is there any way that one can enhance the effectiveness of that mechanism? I'm trying to look at maybe methods of prevention.
Well, the way to prevent glaucoma really is to detect the disease at the very earliest stage. And people that are at higher risk of development of the disease should try as much as possible to go for routine medical eye examinations at least once or twice, or once every year or once every other year. Now, it is only through regular checkups like that that the disease can be detected early.
Okay, the question I want to ask now, sorry for interrupting, is if you detect glaucoma at the stage that you detect that this person has glaucoma or could, have glaucoma, can you save all the sight?
Exactly. And that's the major reason why we talk about early detection. When the glaucoma is detected in the early stages, the doctor examines the patient to classify the type of glaucoma and then commences treatment, whether medical treatment, laser treatment, or surgical treatment. And the aim of the treatment is to arrest the disease at that stage so that it doesn't progress and the patient's vision does not deteriorate.
Okay, we'll need to take a break now. When we come back, we'll continue from there. We're going on a short break. Please stay with us. We'll be back in a moment.